I am here with Dr. Amanda. She is what I consider a guru when it comes to senior pet care and acupuncture. We have been Instagram colleagues for some time now, and we're really making this come to fruition. So, welcome, Dr. Amanda, to the Non-Traditional Veterinarian Podcast.
Hey, thank you so much. Yeah, it was wonderful to meet online, and then we are finally getting to have a more in-depth conversation here. So I really appreciate that. I've loved watching your journey, and I love what you stand for and the path that you're taking with VetMed. So I'm really interested to see where our conversation can go.
Yeah, and we're both out here offering pet parents alternative options and thinking outside the box and really love supporting pet parents in that. So we'll dive right in because there's a lot that I want to know too, because senior pets are so sweet. And I think it takes such a special veterinarian to be devoted to really that sector of patient care because we want all of our pets to become seniors, right? And to be
Right.
able to help them thrive, not just survive, not just to get to 14 years old. So it's like this cool achievement, but that they had like a great 14 years or 15 or 16 or 17 or 12 or whatever it is. And so, what originally inspired your passion to really hone in on senior pet care?
Yeah, I would say I always trended towards senior pets. I just loved their typically calm demeanor. They were just, I feel like, good souls. They're just, in that place of their life where they really want just some calm and some cuddles. And I also felt like the farther that I got into practicing medicine, the more I felt like they were not getting the attention that they deserved. There was a lot of conversation of, oh, well, he's just getting old and this is what should happen. And I didn't love that answer. So as my senior dog started to get older, I had a Chow. That was my dog I had from the age of 12 to the age of 29. Um, yeah, she was
Incredible.
17. Yeah, exactly. Um, so I had her, and as she got older, I started to learn more about, living with a senior dog and what all that entailed, and dementia and cancer and all those, progressions that go with things. And I did lose her when she was 17, to oral cancer. She was a Chow, so she had melanoma. But I feel like she had a really good life. And then the other dog that I had with her, who was my heart dog, Floyd, he got older, and he, unfortunately, being a bigger dog, only made it to 13 years old. But he had a brain tumor, he had dementia, he had severe arthritis. And with him, I just felt like I did everything I knew, and it still didn't seem like I gave him the best quality of life at the end. So I didn't like that answer. And after he had passed, unfortunately, was when I learned more about Chinese medicine and, what you would call non-traditional medicine, which is so funny because it's been around for way longer than traditional medicine.
Yes.
But it's something that I felt like, wow, I need to explore this. And it was a way to not just come to a brick wall when it comes to senior pet care in Western medicine. I feel like there's a place where we say, well, that's as far as we can go. And I felt like this was a way for me to expand that even more. And then the more I dove into it, the more I realized how substantially I could change lives with, all the knowledge that I had. And I felt a little bit alone with Floyd in the end. It was difficult with family not quite understanding and everything like that. So it was somewhere I started social media just in the concept of I want other people to feel seen. I want them to feel heard. I want them to know their options. I want them to understand their options. And it was a passion project that just has progressed tremendously over the past 4 years. Um, and yeah, now I focus solely on senior pets, and I want to learn everything I can about them so that I can help other people with their pets, because I just feel like they need me. They need someone in their corner, more than what we are typically doing in most of our Western appointments.
They do, and I'm so happy to know a colleague out there that is devoted to senior pets because you're right. They're grounded. They want love. They've given us so much love for so much of their life, and it's almost of our way of continuing to love them and nurture them. And I love that you hit on, the Chinese medicine, and it's been around for a long time, and it's kind of considered non-traditional in that sense because it's not talked about enough in your common everyday practices, even though it has been around so much longer than the common practices that most people are exposed to. And so, that you're also out there doing what is established, but also to the average pet parent so alternative or so non-traditional when it's been rooted, and it provides such an avenue for so many pets to be able to continue to thrive, or maybe hospice or palliative care. And so how then would you define, and this is kind of loosely because good means different things to different people, but how would you like define then what is, well, we're not even saying good senior care, but intentional senior care? Like, how would you describe that, and how is it different than what like a traditional clinic is doing for their senior pets that is coming up with the conversations of where they're just old?
Yeah, I think there's a couple of things that go into this. One is we need to go into senior pet care with a concept of health span versus lifespan. So I think it's really
Love
important
that.
for us, yeah, to realize we want them to have a healthy life, which means free of chronic disease, free of pain, free of all those chronicities, while still being comfortable and everything like that, as opposed to I want him to live to be 17 years old. And I know with my senior dog, again, he passed when he was 13. It wasn't enough time for me. It never is, no matter what. But I would not have wanted to just keep him alive for an additional 4 years to say he lived to 17.
Yes.
I want him to have comfortable time. So I think it's really important for us to, as they trend into this senior lifespan, to say, we are focusing on health span. We are focusing on how long we can keep them healthy, free of pain, and comfortable. We're not focusing on the number age. It's very important that we, talk about that initially, because we do know that our dogs and cats, they don't understand what next week means. They know their normal routine every day. They know, 7 a.m. I get breakfast, I go out for my walk, and then at 7 p.m. I get my dinner. I lay down at 9. They get that trend, but they don't really understand what next week means. So it's really important for us in thinking of what's best for them to keep that in mind. Um, and then I think as far as what makes good senior pet care, it's always going to be variable. And that's one thing that I've learned practicing more integrative, alternative, mixed practice is there's a what I like to call like integrative functional medicine approach, because functional medicine is treating the patient in front of you. And I think that is how we need to approach every pet's care, but especially senior pet's care, because they all are going to have their own little quirks, right? Like,
You
oh, he
really
wants
hit
to put a pill
my
in
love
me.
language right now.
Exactly. So like he won't take a pill, or I can't possibly give my cat this injection or these fluids or, things like this. And it's really important for us to say, okay, well, Fluffy hates going to the vet. Like going into the vet clinic, it takes him 2 days to recover. He's not a good, candidate for that. Then we really have to take that into account, because yes, maybe Fluffy would benefit from having laser therapy 3 days a week, but if it's going to take him 2 days to recover from that, it's not right for him. So I think it's important for us to take a personalized approach to every patient and take into account the client's information, the owner's information, and saying, yeah, we need to work on this together. We need to go hand in hand. We need to make sure that we have a good approach that works for your pet specifically. Just because we have all these modalities, we have all these options, doesn't mean that every patient is going to be the right fit for them.
100%. Absolutely. And I really, and I think this is why we're like, hey, how can we like join forces for an episode, and we're going to get into Dr. Amanda's community as well, is because we both really embody that this is a personalized approach. It's not a cookie cutter. And that's how I love how you said health span instead of lifespan. Like that's how we hone in on that for them. And so when it comes to like aging pets, what is something that you wish pet parents knew about aging pets? Because the goal is right for all of our pets to age. Because that means, even though we don't like, we always say, oh, we don't want them to get old, but it's like, but we do, so that we have them for around as long as possible. And so we want them to get old. Like it's like this weird, twisted wishing. I don't want them to age, but I want them to get older to spend time with them. So what is something you wish more pet parents understood about that, either process or that chapter of their life?
Yeah, yeah, it is a really hard place to be, right? Because you're like, I want them, maybe to be a puppy forever or kitten forever, but I know that's not realistic. And I know that it is a gift that I get to have them in their senior years and that I get to have them around. So I think one of the main things that I've learned in life and in pet care is happiness is achieved in the moment. And that means that we have to try really hard not to think about next week, next month, next year. We really need to, with our pets, try and take time where we sit with them and we just don't think about the past, don't think about that vet visit they went to, don't think about that one they have next week. Just really sit with them, pet them, watch their breathing, take in everything about them, and just truly appreciate that moment. And I think we need to do that more often. It's very hard. It's kind of like meditation, it's a very hard thing to conquer. But if we can just live in those moments with them, I think that there's a lot we can gain from that as far as memories that we will have on the other side of it. Um, so I think that's very important. And then I think that as far as things that I wish people knew, going forward from that is it's normal to have anticipatory grief. As much as we try to live in the moment, it is normal for us to think about what happens when they're gone. It's normal for us to say, I can't, I don't know how I'm going to go on without him here. Um, and it's hard, but it's also it's something we can give ourselves space for. I think the anticipatory grief is a big deal, and it's going to be there. And there's also this somewhat dissociative grief that can happen too, where people get to an end stage or a later stage, and they actually have already started grieving them passing with, and sometimes people actually start to distance themselves, intentionally or not, to protect their emotions and things like that. So all of these griefs are normal. They are all okay. These animals depend on us 24/7. It is okay to say they mean more to me than my, grandparents or something like that. I know, that's going to be controversial, but they depend on you every moment of the day. Your distant family can take care of themselves. So there's a much bigger aspect, I think, that comes in with immediate family, which our pets are. And I just want people to know that any emotions that you have are valid. It's okay to give those things space. Caregiver burden is very hard. It's very difficult to be on working 24/7 when it comes to your pet. There's not really downtime, especially when we reach our senior years. We start to get dementia and night waking and, needing to clean them, needing to help feed them, needing to make sure they have their medications. There's a lot that goes into that. And it's okay to feel a lot of different ways about those things. And I just want people to know that age is just a number. It is something where we may get 13 years, we may get 20 years. And it really doesn't matter which of those you get if we are trying to live in the moment with them and allow for that grief and allow for those feelings as they come. Then I think we can help them a lot more with that.
I'm really happy that you brought up like being in the now because they're both important, right? Like looking ahead so that we're not being reactive with their care because we haven't been in the moment, but also being proactive at the same time. And that is it's something that comes up not frequently, but not infrequently with pet parents that maybe we've had nutrition consults or in-home visits that I'm so stressed about this and I'm so stressed about this. And most of the time it's not necessarily older pets and how being in the moment and not necessarily worrying about that next lab visit or lab test or the next visit because and I get it and you do too that like they're important, they're part of our lives, we want them to be happy and healthy, but I'm really glad that you brought that up is just kind of like taking that like reset moment because they deserve it. And being so caught up in the next and the next and the next and the tomorrow and the next year and the next month that not only are we missing out on time with them, but how it can affect their health. And I'm really glad that you brought that up. And so because even the pet parents who have younger pets that are like, I just want them to live forever. What are the common signs then that are maybe labeled as old age that people maybe dismiss and, oh, that's just old age, that are really treatable? And what is, I guess that also ties into like, what's a myth about senior pets or senior pet care then that you would like to debunk? Like, I feel like those kind of go hand in hand.
Yeah, definitely. So I think there's one of the phrases that I don't love is, um, he's too old for X. They're
Yes.
too old for a dental. They're too old for anesthesia. They're too old for those things. Or saying, oh, he's just getting old. And I think it's really important for us to debunk all of those things. But I think when I work in general practice, I go into rooms with senior pets and I will typically say, hey, do you have any questions about Max today? And most of the time, it's no, I think he's doing okay. And then, Max is 13. So I start to look at him and I say, hey, he's got this haziness in his eyes. This is normal, but it may affect his vision a little bit or his, ability to see at night, those types of things. Also, do you notice that when Max gets up from laying down first thing in the morning that he's having to stretch a little bit more now to kind of loosen up his joints and get moving? Or does he seem a little slower in the morning? When you're going on your walk, is he lagging behind a little bit more than he used to? When he's going up and down the stairs, does he stop and look at him a little bit longer than he used to? He used to just bolt up those stairs, and now he's kind of stopping and looking and trying to figure out how to get his footing and, very minor details. Has he started to wake up in the middle of the night now? Like, is he not resting as well all the way through the night? Um, Cats, I think it's important for us to say, oh, are they jumping like up
Yes.
onto a chair and then up onto the counter instead of straight up on the counter like they used to? I think it's really important for us to pick up on those subtle signs. And usually in a room, when I ask someone, are you seeing those things? They go, well, yeah. And they don't know that it's a problem to ask me about. They don't know there are things that we can start to intervene with now. So it's really important for us as veterinarians to ask the right questions. And that's part of what my mission is to make people more aware of these things so that when they do go in for their vet appointments, that they know what things to bring up. Because as veterinarians, we typically have 15 to 30 minutes in every appointment. We don't always have time to ask, 15 extra questions about how they're doing and go through all of those things. That's just the reality of it, unfortunately. But I think as a team, if we can come together and ask a couple more probing questions and have pet parents who are a little bit more aware of these things and have debunked some of these myths, then we can really get more health span with our pets. We can get a longer, healthy lifespan. I think it's really important for us to understand that it is a little scarier when they're older to undergo things like anesthesia, dentals, those types of things. But it is also important to have the conversation that doesn't mean they can't go under anesthesia. I did a dental on a 22-year-old dog once. He did great. He was fine. I had a Jack Russell once that was 17 and he came in for euthanasia because he wasn't eating. And I talked the owners into letting me do a dental cleaning on him. We took out most of his teeth. And he came in 2 weeks later and they said he has not acted like this in 5 years. And it gave him more years of happy life. It's just a lot of times we hear the horror stories or we, just don't know, we don't know. And it's hard for us to know we can do these things safely. Obviously, there's always risks with any medicine or procedure or anything like that. But there are ways that we can help them because, again, coming back to it's about their healthy life. So if they're living in chronic pain, like dental pain, for years, is that really the life that we want them to have? Or do we take this risk of anesthesia, do a proper workup beforehand, and potentially allow them to be the puppy they were 5 years earlier again?
Absolutely. And you said it briefly, it's Like when you know better, you can do better and you only know what you know. And so that is our kind of our responsibility as veterinarians is to let people know, like, yes, this is common in older dogs, but it doesn't also mean it's normal. Just because something's common doesn't mean it's normal, doesn't mean you can't do something about it. And I think it's incredible that you're giving pet parents resources, you're giving them hope, you're letting them know just because, well, he's 13. Yeah, he has arthritis. Yeah, he probably does at his age. And, then we have to take into his whole account of his health history. But it doesn't mean that he doesn't deserve to be comfortable. Because, like you said, what happens if getting him comfortable gives him another 3 great years, not just 3 years on paper, but 3 great years. And that leads me to you are a acupuncture queen. And
Yes.
so I love that. It is so wonderful on what it can be a tool for pets. It's not invasive. It can be and granted, I'm not certified in acupuncture. It's something on my vision board, but I feel like it can work for almost every pet. And you and I definitely don't believe in cookie cutter. And so, how do you see it helping senior pets, cats, dogs, the most? And how would you explain it to maybe someone who's like, I've heard about it, but like, I didn't know my pet could have it, or I've had it done, or, some people don't even maybe, it's not even on their radar. So, how do you see it helping? And how would you explain it to someone who's like, tell me more? There's an option for my senior pet?
Yeah. I took acupuncture courses about 4 years ago with the idea of using it for an additional pain treatment, for arthritis treatment. And then when I started to take the course and learn about Chinese medicine and all of the different things I can do with acupuncture, mine was blown a little bit. And it has been really amazing to see how much we can do just by placing needles in the body, right? Um, as far as what is acupuncture and how does it work, it is millennia old. It's a very old modality. There are studies done in people as well as animals from many, many years ago. So it's something that's been around for a long time. And the great thing about it, in my opinion, is the worst thing that's going to happen is that it doesn't work. Um, so it's not very scary. There's not a lot of major side effects to it. It's just I'm going to place a couple very fine needles. And when we talk about acupuncture needles, 10 acupuncture needles can sit inside of the hub of a needle that you get a vaccine with. So when you go get a flu shot or something like that, you can fit 10 acupuncture needles inside of that little needle. So I think it's really, yeah, it's really important for people to understand they're very small. So they typically, our dogs and cats typically don't react substantially to the needle placement itself. I have a lot of clients who have patients who don't do well in a hospital setting, and they do really well for acupuncture. There was a dog I did acupuncture on for a couple years, and she would have to get a muzzle as soon as she went into her general practice vet. But I was able to do acupuncture on her without anything. It was just me and her, and I would give her a little bowl of frozen fish and she would lick on it, and I was able to place needles and do everything. And her vets were still amazed that I was able to go through that with her once a month, and she was so good about it. And that happens a lot for what I see. So I think a misconception that a lot of people have is that, oh, well, that won't work for my pet because they're reactive or they don't do well in that scenario or something like that. And you just don't know how they're going to do. And there's a lot of things we can do to help them be more okay with it, whether that's having the owner petting them or having, like some frozen food that they like, something to occupy them. All of those things can help a lot. There are also calming points in acupuncture. So there's some places that we use to help them calm down and release some endorphins. One is right on the top of the head. And I've placed a little bit of B12 there, and given them a couple minutes if they're more stressed, and typically they do start to calm down. And then we can go about the rest of the procedure that way. Acupuncture, there's a couple ways I explain it. One, the more Western minded concept, if people don't want to dive deep into the Chinese medicine, is to say, I am placing needles, I am creating little areas of micro trauma just like you would get if you were to go get a microderm facial or something. And we are bringing in healing factors to that area. So I'm going to place, bring in some proteins and healing factors, and they're going to come in and try and help heal that area that I'm placing the needles in a Chinese medicine standpoint, we know that the body is always in this state of flow. So we have the yin and the yang, just like the symbol, and we're in this constant state of flow. And if everything is flowing appropriately, then we have an equal amount of the black and the white on the yin and yang symbol. If there's a blockage or stagnation or something like that in that flow, then we're going to get a really big black area and a really small white area, or vice versa. So in the aspect of Chinese medicine, we're basically just trying to get the body back into flow. We're figuring out where the problem is, and we're trying to place needles in those areas to either open up the flow in that area, release things, that type of thing, to get everything moving back into equilibrium where it needs to be to keep them comfortable. So yeah.
I It's to me, acupuncture is so interesting because you can use it for so many things, like so many things from what I read about, and I think it's a really cool non-invasive tool. And I didn't know that about the 10 needles in one, like fitting in one.
Yeah.
And I've never had it done to myself. I actually would love to have it done. I think it is a really good collaborative therapy that can be used, and it just seems like you could personalize it so much as far as like where you're placing them and how often. And so it probably works very well on its own. And it probably is something you can combine with other modalities, whether someone wants to take a more integrative or functional approach or stay very traditional and conventional, right?
Yeah, yeah. So I have patients, most of my patients see Western practitioners as well. So a lot of them, are on medications. They're on anti-inflammatories, they're on other things for whatever the problem is that we're treating, anxiety meds, things like that. And we're also integrating acupuncture and potentially laser therapy. I also have electrical stimulation, which is basically like a TENS unit for the needles, and it helps to activate those points a little bit deeper. So a lot of times if we have patients with like geriatric onset laryngeal paralysis and polyneuropathy or gulp, which is a common problem in older Labradors, or if we have like degenerative myelopathies, those types of things, degenerative nerve conditions, those respond really good to electrical stimulation. So there's additional things we can do onto those acupuncture needles. And I think it is very important for people to understand that it can treat so many things. I treat a patient with seizures. I treat a patient with anxiety, severe debilitating anxiety, and I treat a dog with gulp or laryngeal paralysis. I treat a lot of arthritis. I treat intervertebral disc disease. Instead of going the surgery route, we can, have the acupuncture route. I treat dementia. You can treat diabetes or help treat, diabetes, heart disease, those types of things, kidney disease. I have a lot of patients who get years with kidney disease diagnoses, which isn't extremely common, for them to get years on the other side of it, especially dogs. I had a dog that I did acupuncture on for 2 years that had
Wow.
kidney disease stage 2 when I started. And yeah, so it's amazing the things that we can treat with it. And in conjunction, I typically don't recommend only acupuncture, but if someone isn't in a place where they trust or want to pursue Western medicine, then that's fine too. But I think that we can help collaboratively. I think it's really important for us as a profession to get over this concept of it's either Western medicine or Chinese medicine. I think it's really important for us to realize that, and what I always say is where I'm going to change lives, where I'm going to make a difference is with an integrative approach, because Western medicine has a great purpose. It is very good at treating when a problem has shown its, head. And Chinese medicine is very good at preventative medicine. So it's very good to help treat the underlying problem and to help prevent it from coming back. So I think putting those two together is the only answer. I think it's a disservice to our patients if we're not allowing space for both.
I am really glad that you brought that up because the what I find myself, I'm like I need to get my phone, record and play it in so many one-on-ones, whether it's nutrition or in homes or in a clinic, is And I agree with you because I look at it as Western medicine. And if those of you who've never heard the term before, it's very traditional, conventional, like what we see as everyday vet care. And then there's Eastern Chinese medicine. And I look at Western traditional conventional medicine as the fire extinguisher. Because if you have a fire in your house, you want to grab the thing that's going to put it out right away and try and support it until the fire truck can show up. And I feel like that is where the integrative, functional, or what a lot of pet parents know as holistic, when really they're actually embracing like an integrative approach. It is allows that to come in to either get to the root cause or be other modalities. And so it's even if you really want an integrative or functional approach, or as pet parents sometimes say, all natural or holistic approach, is that there's still some great aspects of Western and conventional traditional medicine. And sometimes we even need those. Like if your pet needs surgery, it's very traditional and conventional. And how can we come in, like you're saying, with this Eastern Chinese medicine approach and help support this pet to either help support them with detoxing, or help them maybe not actually sometimes we can't undo what's been done, but how do we support them going forward for that health span, like you talked about. And so it sounds like there's, and from what I know, and for maybe pet parents who didn't know, that there is a lot of options when it comes to acupuncture. And the thing I really like about acupuncture is that it just seems it is so personalized and that there's really not a cookie cutter approach as far as frequency and points. And it just seems it is so pet specific, which I find that so freeing that if like let's say you have three dogs, that they all can be approached uniquely rather than, well, if it didn't work for this one, it's not going to work for that one. I think that's like gives us so much freedom.
Yeah. And I think that is one of the coolest things that I've learned about Chinese medicine, but one of the hardest concepts to grasp when I was taking classes is because in Western medicine, there's not one way to fix it, but there's kind of a general way that you go about it, right? So if you have a dog with an infection, you pretty much treat it one way. In Chinese medicine, if I have a dog with arthritis, that could be a kidney qi deficiency, it could be stagnation, it could be a blood deficiency, it could be Wei syndrome, it could be bony B syndrome, it could be so many different things that it was very hard to understand that Chinese medicine doesn't have a cookbook recipe. There's no way to like funnel it down to these two different classes. Every patient's going to have their own diagnosis based on pulse, tongue, color, things like that, as well as, everything else that's going on with them. You also get information about their personality type and things like that, because there's different personalities. You have like the wood, the fire, the earth, the wind, those types of personality traits, and you can treat based on those 5 traits too. So there's just so many different ways to treat. I think it's really important for us to understand with acupuncture and Chinese medicine that there's not going to be a recipe. And that was one of the hardest things to learn, was because if your head is very Western minded, you're like, it's science, there's an answer. And it's not. there's just this big flow of different places you can go. And I can have a patient that I start with a kidney qi deficiency, and we kind of fix that, and then that uncovers a blood deficiency, and then we have to treat that. So you can have a patient who goes through different things, and with senior pets, that's very common because they typically have a lot going on. So you're going to uncover things as you open the doors to this. One of the things that when I was taking acupuncture courses, I thought was most impactful was my teacher said, if the ancient Chinese had access to MRI machines, they would have used them, right? They wouldn't have just said, nope, we're not doing that. They would have used all the options that they had to get all the information that they could. They just didn't have it. So I think it's very important for us to be able to bring these things together. There was a concept, a couple hundred years ago when Western medicine started, where Western medicine came into play, and there was kind of a push by Western medicine to make Chinese medicine seem like witchcraft or wizardry or something along those lines, and kind of professionalize it. And I think we're getting to a point now, knowing what we know, where we are learning about integrating and people are getting a little bit smarter about those things. But I think and I even in hospital settings, I'm seeing people that are being trained in osteopathic medicine as well as a medical doctor. There's a lot of crossover in that with human medicine and everything like that too. So I think it's important for us to be open-minded about those things and to kind of debunk the myth that Chinese medicine is doesn't have studies behind it or doesn't have results behind it, because there are hundreds of studies. That's one of my big things is I'm only going to recommend something to you that has been studied. I'm only going to recommend things that have proven studies behind them, case reports, those types of things, because I don't want your patient to be the test subject. But there's so much information behind acupuncture and Chinese medicine in general, that if you just actually went and did a search on it, you would find. I think it's important for us to, yeah, focus on those things.
And what I learned when I went through, so I went through food therapy at the Two University, and my initial schooling or additional education of nutrition was Chinese medicine based. And you're right, like sometimes you uncover one thing, and I know that some pet parents just want to get to like the final destination as quick as possible. I also value my time and getting my pet as healthy and quickly as possible. I also see it as the options for customization are endless in the best way
Yeah.
for our pets. That it's not, again, that it's not like because this didn't work because the Rimadyl didn't work for your last dog's arthritis or it made an upset stomach. Like this is what gives us more options. That it's not like you said, it's not like shaming or tossing Western conventional medicine to the wayside. It's like how can we make things better? How can we like cohesively blend the two to give our patients and our pets the best option as possible? And I just see it as there's so much customization, and also like what you were saying based on their personality. um and in the Chinese medicine is known as their constitution, and if depending on if they have stagnation or if they're yin deficient, also like the seasons and where you live depending on the climates. And I think it's really cool that they can be addressed as like their own unit rather than here's the box, when you don't fit in it, I'm sorry, fit in it as best as you can, and that's just how it is.
Yeah.
And I think it just gives pet parents so much more hope, and having these conversations and letting pet parents know that like there are options out there. There are veterinarians like us out there that are willing to hold space and give you options and guide you through these potential plans for your pets and to give you hope, and not only for this pet but for all your future pets too. And so I know you've been practicing for quite some time. Do you have one patient that really sticks out to you, like a favorite success story that also really helps drive the belief on that this is such a valuable way for pet care, especially in seniors?
Right. Gosh, I have so many favorites from acupuncture. I will run through like a few quick ones. One, sorry, my dog is dreaming. I don't know if you can hear her.
Oh, we love
When they get
that.
older, they dream
Free rest.
heavier. Um, so one of my most recent favorite patients that I'm treating is a little dog that has dementia. And his dad has been getting up for the past year with him in the middle of the night because he's waking up in the middle of the night and has to pace around on the main floor of the house. And then he usually settles back down eventually, in the wee hours of the morning. And then dad lays on a floor mattress and sleeps for the past year. And he just said, if I could just sleep through the night, that'd be so cool. And you have something that's been going on for a year. That's pretty chronic. It's hard for us to get on the other side of that. So I always come in with the concept. I never try to like underball people or lowball people, but I always try to be realistic and say,
Yes.
look, you may get results after the first session, you may not. We need to at least give it 4 sessions before we really say, is this helping or not? We need to give it time. Within 2 sessions, 2 weeks, he was sleeping all night. Yeah. So
Dr.
dad's,
Amanda,
yeah.
that's incredible.
So, like, we're helping cognitive dysfunction, which in Western medicine has no reversal, no treatment, no nothing. We're giving them a good lifespan. He was like, some mornings he sleeps till 8 a.m. now. Like, usually he's up at 6, but he was like, some mornings I get, they go to bed at 10 and he's asleep until 8.
Okay, here's the cool thing. You help that dog. You
Yeah.
also help that pet owner and you help their bond.
Yes. Yeah. the quality of life, the caregiver burden, the caregiver fatigue, the grief, everything with it is just substantially improved. So, Cody is a really good success story that I just had. One of my other ones that's been a little longer term is Jake. Jake is a therapy dog. He goes into the Ronald McDonald House and visits kids. Yes, he's a wonderful, he's turning 11 this week, I think. 11-year-old Labrador.
Happy
And
birthday, Jake.
yeah, he had this chronic tendon ligament injury in one of his back legs when I started seeing him about a year and a half ago. And they had gone to the local university. They had done all these things. They couldn't get any answers. One of his back legs would just drop lower than the other, and mom could tell he was uncomfortable. I think it was actually a year ago. It was about November of last year. And she told me when we first met, you know, I'm going to retire him at the end of the year because I just don't think he can do this anymore. But I want him to be comfortable for the time that he has, right? And I said, okay. And so we started, and within a month, he was walking completely normal. He was doing great. He still, a year and a month later, goes to the Ronald McDonald House. He is not retiring anytime soon. He actually started going back hunting, like he goes running and hunting with the male owner is retired medical doctor, and he has another 2-year-old dog that they go duck hunting with. And Jake now goes back out with them again. He doesn't do as much of the hunting, but he gets to run around. And he said he just runs like the wind. Like he is so much fun. He looks so good when I see him. And yeah, brought him out of retirement. He gets to keep going and doing exactly what he loves doing.
What I love hearing about these stories is that you just told us two very well-loved pets that have very different purposes. They're unique and very different conditions going on and how acupuncture has helped them. And I hope that that gives the pet parents listening to this, or maybe even other veterinarians listening to this, other professionals, that there are options out there that whether everything, we've tried everything, because I'm sure you've heard that a lot, or
Yeah.
they don't want to try because their last pet, like there was some sort of experience that happened, or maybe
Yeah.
their own personal beliefs in how they manage their health, that this can be an avenue for so many pets. This doesn't have to be for young or for old or for kidney failure, or there's so many avenues out there, and for the customization to be there and to help these pets. And like you're saying, what you can do is you can't promise that you're going to have results that the is going to meet the owner's expectation after one session or two sessions or three sessions, but also what do you have to lose? Like this pet owner sleeping on, that's so sweet, on the floor mattress with their dog that they care so much about, and the one who's this dog has a job, a really important job,
Yeah.
to go to the Ronald McDonald House, that you are helping improve lives. And I think it's so cool. And it's just so cool to know you as a colleague too, to be like,
Oh,
that's my colleague doing that. I just think it's
yeah.
incredible. And so
Thank
if
you.
listeners could walk away, who maybe they have a senior pet, or they're thinking about getting a pet, or their pet is 4 years old and they're like, well, I want him to become a senior. Like, I don't want him to get old, but I want time with him. What is something you wish that they could walk away that would be one shift, one mindset change, maybe one belief in how they care for their aging pet? Like, what would you want that to be?
Yeah. I think it's really important for us to know that their needs change as they become a senior. I think that's vital because we a lot of times just don't want to think about the fact that they're becoming a senior. But if we can understand that when a Labrador hits the age of 7, he's a senior, right? And his needs change. The amount of calories he needs changes. You know this very well. Their needs change as far as their nutrition, their diet, their exercise routines, these types of things. Everything shifts, but that doesn't mean we're counting down the days until he's gone. They can live half their life as a senior or more. That Labrador, I met a 15-year-old Labrador last night. They can live very long lives in that senior era, but we need to support them appropriately. So I think it's really important for pet parents to understand that one, just because they're a senior doesn't mean their life is ending. And two, yes, their needs change. And if you know that and you get on top of that early enough, then you're going to give them a longer health span. You're going to give them more good time if we can just accept it and change their lifestyle and their life the way that's most appropriate for that.
I love that. Again, what I hear is personalization, customization, not putting the cart before the horse
Yep.
and treating that dog and like being present with them. And
Yep.
like you're giving them hope. I think that's so wonderful. I'm so glad that we were able to connect. Where can pet parents find you? Because what you have to offer is so valuable. How can they find you? Where can they find you?
Yeah, so I started everything on Instagram. So Instagram is kind of my main hub. On there, I am senior pet vet. There's underscores between senior and pet. And same on TikTok, also senior pet vet. I do have Facebook that is under the Senior Pet Connection. And I also have a website, so seniorpetvet.org is a good place that everyone can come and find me. Everything interconnects, so one way or another, they'll find videos. I have lots of free videos that come out 5 times a week at least, and there's resources. So I have a free newsletter that has weekly send outs of up and coming things in senior pet care, feel good stories, things to raise morale, that type of stuff. Yeah, so I'm a little bit of everywhere.
We love that. And I will make sure that that's all linked so that pet parents can find you. And so whether if they have a senior pet and they're like, yes, I need someone who's speaking my language on where my pet is, that they can find you. Thank you
Awesome.
again for being on the Non-Traditional Veterinarian.
Yeah, thank you for having me.